Hi everyone. Welcome to Nazari Dental Academy. Today is different. I am very happy because today I am going to interview Dr. Syozi Nakashima. Dr. Syozi Nakashima has been a senior researcher in Lion Corporation. He is one of the most famous researchers in field of preventive dentistry, and now he is in the Faculty of Dentistry in Tokyo Medical and Dental University. Dr. Nakashima, thank you very much for accepting my invitation.
It's my pleasure.
I appreciate it. So, Dr. Nakashima is going to answer some of the questions that I have prepared regarding the function of toothpaste or dentifrices. So, the first question, very basic, I will start, is that some people, they think if they brush their teeth with a good toothbrush, it would be enough. Without using a toothpaste, they can clean their teeth. Is it possible to do that?
I don't think so. We should use dentifrice. Of course, you can remove some food debris just by toothbrushing, but it's very difficult to remove the biofilm. Biofilm is a strong cause for caries incidence and gingivitis incidence and some other diseases.
So can you please also explain what is biofilm?
Okay. Biofilm is composed of bacteria in oral mouth, and the bacteria adhere strongly to the tooth surface or some narrow area, so it is very difficult to remove. So in the dentifrice, there are abrasive. So such abrasive is effective to remove strongly adhered biofilm. And another important thing in terms of using dentifrice is detergent. So detergent inhibit re-adhesion of biofilm component in the tooth surface.
So very interesting. So biofilm is going to be formed after eating, right?
Yes.
So with the food and saliva and the bacteria, it will coat.
Yes.
So the abrasive will remove it, and then the detergent will inhibit the adhesion.
Yes.
Oh, I see. Very interesting. So please tell us about the abrasives and also the detergents. So what elements are there? How many % normally of the toothpaste is?
Okay. In dentifrice, company use a variety of abrasive. Recently, most of the famous dentifrice contain silica as abrasive, because silica is a very good agent in terms of compatibility with active ingredient like bacteria killing agent, fluoride, or some other agent. And the percentage of abrasives is dependent on the product, but I believe it's around 20 to 30%.
20 to 30%.
And concentration of detergent is around 1 to 2%.
Oh, very low amount.
Very low.
And how about the rest? So about 20 to 30% is abrasive, 1% is detergent.
Next important ingredient is humectant agent. It is like a soliditol or glycerol. So by containing such a agent, the texture of dentifrice is smooth, and it prevents hydration of dentifrice. So it is very important to have such a nice texture.
Okay, so for the texture like a gel, it can be also creamy. So that's okay. So
and another ingredient is water.
Water. Like how many % normally?
20 or 20 to 30 to solve the active ingredient.
Yes.
Or to solve detergent.
So when we say the active ingredients, we are talking about fluoride and antibacterial agents.
Yes.
I see. So normally for kids, we have non-fluoridated toothpastes. So what is the difference in efficacy of fluoridated and non-fluoridated toothpaste? Are they really different in terms of efficacy in your opinion?
There is no scientific report on the efficacy of non-fluoridated dentifrice because in the modern countries, scientists believe that fluoride is the most effective agent to remove to inhibit caries incidence. So, and we should contain fluoride in every dentifrice. So it is impossible to compare the two different. One is a non-fluoride dentifrice, and other is a fluoride dentifrice.
Okay. But in your opinion, what is your opinion about this? Are they different?
Of course, different.
Very different. Okay, thank you. And nowadays in the market, we see different kind of toothpaste. As you mentioned, the basic function is for cleaning and like anti-caries, anti-tartar, and but nowadays we have some kind like whitening, anti-hypersensitivity, and the other specific toothpaste. So what is your opinion? Should normal people and ordinary people go for them, or just a very normal toothpaste would be enough?
We should. I can say that there are two kinds of dentifrice in terms of government regulation. One is a cosmetic dentifrice, and the other is a therapeutic dentifrice. In cosmetic dentifrice, there is no active ingredient contained.
No fluoride,
no
and
fluoride, no antibacterial,
antibacterial.
no anti-hypersensitivity. Okay, but therapeutic dentifrice contain a variety of active ingredients like fluoride, bacterial killing material, anti-tartar agent, and anti-hypersensitivity agent. So if you have anti-hypersensitivity, you should use a suitable dentifrice for anti-hypersensitivity. So usually we should do, I can recommend a therapeutic dentifrice, not cosmetic.
With the active ingredients.
Yes.
Okay, that's very important. So, how about the anti-hypersensitivity? Because nowadays I think, perhaps because of the acidic drinks and beverages and food, tooth erosion is a very common problem. So maybe because of that, we have also the incidence of hypersensitivity. So some people, when they buy a toothpaste for anti-hypersensitivity, they are expecting very fast effect, like immediately or after 1 day. So I would like to have your opinion about the efficacy and different types of anti-hypersensitivity toothpaste.
In the market, there are two kinds of anti-hypersensitivity dentifrice. One contains potassium nitrate, and it exerts very soon, just after use, because the potassium ion inhibit nerve activity. So, and you can expect the very soon beneficial effect. But other dentifrice containing some agent which occlude the dental tubule opening. So in order to reduce the size of diameter of dental tubule, you need some long, but it takes 1 week.
About 1 week.
Yeah, but once dental tubule opening occurred, it lasted quite a long time. But other case, if you use a potassium containing dentifrice, when you stop using dentifrice, you feel again.
It comes back.
Yes.
Okay, so you mean that there are two types. One is affecting the nerve, the other one the structure.
Yes.
So it's changing the structure.
Yes.
And so you mean the one that is changing the structure is better
I
because
believe
the
so.
effect will remain for longer period
Yes.
of time. Oh, that's very interesting. I didn't know that. So
Really?
yes, of course.